ICANotes versus Behave Health. ICANotes serves a broad range of behavioral health settings, while Behave Health focuses exclusively on addiction treatment. That focus difference shapes the workflows, the billing, and the add-on fees you end up paying. Here is how the two compare. ICANotes versus Behave Health, a comparison for behavioral health organizations weighing which EHR fits their business. We cover who each platform is built for, how billing works, and how telehealth and ePrescribing are priced. Verify current vendor details directly. According to its website, ICANotes works well across behavioral health, individual, couples, group and family therapy, case management, inpatient, psychiatry, addiction therapy, psychology, and social work. ICANotes serves the addiction treatment industry, but not SUD patients and clinicians exclusively. It also serves a good number of general mental health organizations. Behave Health focuses exclusively on addiction treatment and adjacent organizations, including sober living and coaching services. A platform built for a broad audience asks you to scroll through extraneous workflows and irrelevant menus to find what you need. And add-on fees can stack up. Because Behave Health focuses only on addiction treatment, you won't have to scroll through extraneous workflows and irrelevant menus to find what you need. Competitor pricing and features in this comparison were accurate as of original publication and have not been re-verified. Confirm current details with each vendor. Behave Health is designed specifically for addiction treatment. Its focus scope keeps workflows direct and reduces navigation overhead. Behave Health is designed to assist with IOP, inpatient, residential, PHP, medically assisted detox, addiction treatment group practices, recovery residences, and sober living homes. It also supports halfway houses, justice-involved and transitional housing, and recovery coaching services, all within one focused platform. 3 areas decide which platform fits your organization: billing, telehealth, and ePrescribing. Let's walk through each. These are the places the source comparison found the clearest differences between the two platforms. Difference 1. How billing is handled. Behave Health offers RCM services for organizations that want billing support alongside the software. ICANotes appears to offer connections to third-party billing partners, Waystar, Ability, Change Healthcare, or eTactics. Verify current options with ICANotes directly. Difference 2. Telehealth pricing and setup. Both platforms support video appointments, virtual treatment planning, ePrescribing, and automatic appointment reminders. Behave Health supports telehealth with any web-based meeting platform linked through the internal calendar. At publication, ICANotes appear to charge a per-clinician monthly telehealth add-on. Confirm current pricing. Difference 3. ePrescribing for controlled substances used in MAT. Both Behave Health and ICANotes integrate with DrFirst for ePrescribing. In Behave Health, ePrescribing via DrFirst is available as an add-on. At original publication, ICANotes ePrescribing license was listed as a paid add-on, with a per-provider monthly fee, plus a one-time activation fee. Pricing has not been re-verified. If you are a current ICANotes user weighing whether to stay or switch, Behave Health provides a structured migration path. The team handles data migration, staff training, and parallel go-live support, so the transition does not disrupt your operations or revenue cycle. Operators often explore alternatives for ASAM, COWS SIWA, Medication Pass, and Part 2 workflows, or a dedicated admissions CRM with lead tracking and referral analytics. Behave Health's all-in-one app puts clinical, administration, staff, admissions, alumni, residents, treatment plans, billing, and insurance authorizations at your fingertips. Clinical documentation, billing, and insurance authorizations live in one focused platform built only for addiction treatment. Operators wanting all-in-one tools, property management, vehicle tracking, maintenance scheduling, can run them in the same platform as the EHR. Behave Health can also help direct you to resources for licensing or accreditation by the Joint Commission or CARTH. Stop paying for a general EHR that isn't built for addiction treatment. Schedule a demo to see how Behave Health compares at behavehealth.com. See the addiction-focused workflows, in-house billing, and migration path for yourself at behavehealth.com.